angiotensin 2 receptor blockers.
Hi, I am also angiotensin 2 receptor blockers.
My generic names are azilsartan (EDAR-B), candesartan (Atacand), eprosartan (Teveten), irbesartan (Avapro), telmisartan (Micardis), valsartan (Diovan-Prexartan), losartan (Cozar), olmesartan (Benicar), entresto sacubitril valsartan, and bivalson nebivolol valsartan. My brand names are Atacand, Avapro, Benicar, Cozar, Diovan, Micardis, and Teveten.
My chemical names in different classifications are: for candesartan, Atacand; for azisartan, EDAR-B; for eprosartan, Teveten; for irbesartan, Avapro; for telmisartan, Micardis; for alsartan, Diovan; for losartan, Cozar; for olmesartan, Benicar; for entresto, sacubitril or valsartan.
For drug classification in therapeutic, I am antihypertensive.
My pharmacologic drug classification is angiotensin 2 receptor antagonist.
For pregnancy category, I am FDA pregnancy category D. The use of angiotensin 2 receptor blockers during the second and third trimester of pregnancy is not recommended as it can cause fetal injury or even death.
My mechanism of action. Angiotensin 2 is a very potent chemical form in the blood that causes muscles surrounding blood vessels to contract, thereby narrowing the vessels. This narrowing increases the pressure within the vessels and can cause high blood pressure or hypertension. Angiotensin 2 receptor blockers or ARBs are medications that block the actions of angiotensin 2 by preventing angiotensin 2 from binding to angiotensin 2 receptor on the muscles surrounding blood vessels. As a result, blood vessels enlarge or dilate and blood pressure is reduced. Reduced blood pressure makes it easier for the heart to pump blood and can improve heart failure. In addition, the progression of kidney disease caused by high blood pressure or diabetes is slowed. ARBs have effects that are similar to angiotensin converting enzyme or ACE inhibitors, but ACE inhibitors act by preventing the formation of angiotensin 2 rather than blocking the binding of angiotensin 2 to muscles on blood vessels.
For pharmacokinetics in absorption after oral administration, I am rapidly absorbed but have a wide range of bioavailability. From a low of 13% for eprosartan to a high 60 to 80% for irbesartan. Food does not influence the bioavailability except for valsartan, a reduction of 40 to 50%, and for eprosartan is increased. For distribution, for some of the ARBs, limited dose peak of plasma level or areas under plasma level time curve are observed. Most of these drugs have high plasma protein binding, which is 95 to 100%. Irbesartan has the lowest group binding, 90%. The steady state of distribution volume varies from a low of 9 liters candesartan and a high of 500 liters telmisartan. For metabolism, it is metabolized by the liver. For excretion, it is excreted via bile into phases, from 2% of telmisartan to 33% of candesartan in the oral dose, which is excreted in the urine. Half-life is short for candesartan, silicetyl, and losartan, 1 to 4 hours. Intermediate for eprosartan and valsartan, 5 to 10 hours. And longer for candesartan, irbesartan, and telmisartan, 11 to 38 hours. The active metabolite for losartan has a longer half-life than for the parent drug.
Angiotensin 2 receptor blockers indications. Like ACE inhibitors, it can also be used alone for treatment of hypertension or in combinations with other antihypertensive agents. Then, utilized in treatment of heart failure for patients who do not respond to ACE inhibitors. By blocking the effects of angiotensin receptor in vascular endothelium, these drugs are able to slow down the progress of renal disease for patients with type 2 diabetes and hypertension. For children, safety and efficacy of ARBs has not been established in this age group. For adults, ARBs are not allowed during pregnancy. For older adults are more susceptible to drug toxicity because of the underlying conditions that would interfere with metabolism and excretion of drug. Renal and hepatic function should always be monitored. Then now, let's talk about my side and adverse effect categorized per body system. First, for central and peripheral nervous system, I can give you fatigue and dizziness. For gastrointestinal system, I can give you abdominal pain, diarrhea, and dyspepsia. For respiratory system, I can give you sinusitis, cough, URTI, and viral infection. For musculoskeletal, I can give you pain and arthalgia.
Nursing responsibilities. It has before, during, and after. So before, nursing assessment. Conduct assessment, history taking, and examinations includes assessment of the contraindications to the drugs. Example given: drug sensitivity, hypovolemia, renal dysfunction, and many more. To prevent potential diverse reaction. Another is obtain baseline status like weight, vital signs, overall skin conditions, and laboratory tests like renal and hepatic function tests and serum electrolyte to assess the patient's response to the therapy.
For nursing responsibility during nursing diagnosis. Nursing diagnosis that can be formulated in the use of the drug for therapy. First, ineffective tissue perfusion related to fluid excretory effect of the drug. Second, impaired skin integrity related to dermatological effects of the drug. Third, risk for injury related to CNS side effects of the drug. The nursing implementation. Educate the patient on importance of healthy lifestyle, which include regular exercise, weight loss, smoking cessation, and low sodium diet to maximize the effect of antihypertensive therapy. Administer drug with food to prevent GI distress associated with drug intake. Monitor renal or hepatic function tests to alert doctor for possible development of renal or hepatic failure, as well as to signal need for reduce of drug dose. Provide comfort measures such as quiet environment, relaxation techniques to help the patient tolerate the drug effects. And lastly, educate the patients and the family members about the drug's effect to the body and manifestations that would need reporting to enhance patients' knowledge on the drug therapy and promote adherence.
So for after, there will be an evaluation and desired outcomes. First, patients response to the therapy through blood pressure monitoring. Second, monitor adverse effects. Example given, skin reactions, cough, headache, and etc. Third, evaluate patient's understanding on drug therapy by asking the patient to name the drug, its indications, and the adverse effects to watch for. Lastly, monitor patient's compliance to drug therapy. So that's it. Again, I am Angiotensin to receptor blockers, and thanks for watching.
That's all for today, guys. I hope you learned something and thank you for watching. God bless.